Assalamu alaikum warahmatullahi wabarakatuh. My name is Dr. Mohammed Al-Mathbouli. I'm a pediatrician and neonatologist, Mrcpch certified since 2014. Welcome to first video simplifying history taking station in Mrcpch clinical exam. So this simplification actually it's based on logic thinking more than memorization and mnemonics. In mnemonics, the percentage is less than 10%. And that simplification and logic thinking will help you to take a professional history during the Mrcpch clinical exam and all through your career.
14-year-old girl, complaining from recurrent abdominal pain over the past 3 days. No investigations done. And no treatment taken except ibuprofen syrup only once.
Okay, just think about it. Now you read already the opening statement outside the room. It's just as you when you approach your clinic and your nurse will come to you and doctor, we have a 14-year-old girl inside your room or waiting for you in your clinic. She's complaining of abdominal pain, and just when you approach the room, she'll tell you, doctor, I forgot to tell you something. Actually, she's a new patient. We don't have any record for her, no file with us, so we don't know anything about her. So that's the opening statement. 14-year-old girl complaining of abdominal pain. That's it. Just now you need to think about it. What's the next step? But before thinking what's the next step clinically, there are things you need to do.
Good morning, Rina.
Good morning, sir.
My name is Dr. Mohammed Al-Mathbouli. I am the pediatrician who is going to take care of you today. How are you doing today?
I am not feeling well.
I am sorry to hear that. Can I take some history from you?
Sure, sir.
May I know your concern? Open question. This is the way you need to start with. Then start analyzing the concern of the patient in the following way. We analyze main complaint or main symptoms by dividing it into 3 parts. Main piece of information or main part, which is a time-related part, includes onset. That means when, where, and how did it start, the symptom or the complaint. Next, course. Is it stationary, for instance? That means the symptom is always there at the same intensity, or always there but the intensity increases and decreases, or intermittent. That means the symptom or main complaint is on and off. And we need to ask if in case of on and off, is it related to a certain trigger or a certain timing? Next is the duration. So we spoke about the onset, course, then duration, and we calculate duration depends on or since the very beginning of very first symptom started or appeared. Then timing, that means recurrence. Does it recur at a certain time, or is it related to certain circumstances, like for instance when the patient wears like a certain type of leather or certain type of linen, which is contact type of symptom, or only at night like asthma, or related to exertion like heart problems, etc. Next is next part, it's the extra knowledge, which is not related to time. We need to analyze the character of the complaint or symptom. We need to know the site of the symptom, and does it radiate to other places. For example, in case of chest pain, it radiates to left shoulder. In case of subphrenic or subdiaphragmatic pathology, it refers to right shoulder. In case of renal stone, it refers to prostate and groin area, etc. So we need to know the site and radiation at the same time. Next, is it the type? Is it dull, aching? Is it colicky? Is it vague? Is it sharp? Is it electric-like? Type of pain, how the patient will describe the pain. Next is severity. And that is actually, it's a subjective grading from 1 to 10, depends on how the patient himself is feeling the pain. So that's the grades, the grading done by the patient himself, how he feels the pain from 1 to 10. Next, what increases and what decreases the pain or the symptom depends on the patient experience. Then last thing we need to ask about is associated symptom in the form of closed question. We need to ask actually a closed question about other symptom, and that very brief, but we are going to talk about it in details in the next section. Remember that we are still in the complaint section, so after analyzing the main concern, we need to end up this part by asking a closed question related to the complaint. For example, if she's complaining of abdominal pain, the patient is complaining of abdominal pain, we need to ask about vomiting, diarrhea, constipation, pain during urination, for instance, and make sure that you're not going to use any jargon, that means medical terms, okay? But in a brief, closed question style. That means, do you have vomiting? Do you have diarrhea? Do you have constipation? Do you have pain during peeing or during urination? Yes or no? Because we are going to analyze that in details in the section of history of present illness. So just yes or no question. Okay? Next. This part, which is history of present illness, depends actually on the previous part, which is complaint. You know why? Because the main concern of the patient will guide you how to start taking history in this section. Actually, we have 6 groups of systems. Each group contains one or more system. They share the same or very close kinds of symptoms. The groups are, first group is CNS and neuropsychiatry, and they share some symptoms like morning vomiting, abnormal behavior, abnormal gait, headache, weakness, abnormal or symptoms related to vision and hearing error, etc. But we add to this system, we need to ask about arousal, activity, awake and sleep cycle. So we add to CNS and neuropsychiatry, arousal, activity, awake and sleep cycle. Okay, next group of systems like cardiovascular system and chest. And you know, they share palpitation, chest pain, shortness of breath, apnea, cough, etc. Next group, GIT and renal system. And you know, they share steatorrhea, constipation, and constipation sometimes related to renal symptom. A renal symptom may be related to constipation, dysuria, change in urine odor, etc. And we add to this system weight gain or weight loss and or appetite. Next group is hematology and immunology. And of course, you know, their hematology, mainly we discuss the platelet and red blood cells, and immunology mainly related to white blood cells, and both are in the bloodstream. So we group them together and we add to this system asking about lymph nodes. Next group is endocrinology, metabolic and genetic. And you know, they all, 3 of them, they share many of symptoms, including fat distribution, weight gain, weight loss, a lot of genetic things like, for instance, you can find Down syndrome has hypothyroidism, metabolic disease has hypo or hyperthyroidism, etc. So all of them, endocrine, metabolic, and genetics, I group them together because they share a lot of symptoms together. And finally, last group is skin and the musculoskeletal system. Because you know they're just very close to each other. The skin is covering the musculoskeletal system, and usually, mainly the rheumatic diseases, they have both. They've got both musculoskeletal and skin pathology. So now we have those 6 groups of systems. So, if the complaint belongs to certain group, start by asking about symptoms related to this group, then ask about symptom or other symptoms related to other groups of the sex. So first start with the one related to the main group that we are discussing, then ask about the other six symptoms related to other six groups. That will make sure that you're not going to miss anything. So if the complaint belongs to certain system group, analyze or ask about all the symptoms related to this group in details, okay? Then move to symptoms related to other groups in order, in details as well. Do you know what's the meaning of past? Past means let's start from the beginning. That's the way you need to think about it. Think about it like that. At the end of the day, she's a patient. She had a diagnosis, or she had it diagnosed one day, 1 year back, 2 years back, whatever. Then possibly she was admitted, and then after admission, she was discharged, and after discharge, she enjoyed her life and traveled. Possibly she traveled. Then during traveling, she may suffer some sort of trauma. So we need to ask about diagnosis, details, admissions, discharge, traveling, and trauma history. Now let's start. What was the main complaint of her diagnosis before reaching to diagnosis? What happened? Did she go to the hospital or a physician came? Who diagnosed her, GP or a specialist? What investigations were done? Do you have do you have a record of those investigations done? What was the medication prescribed for you after first time you were diagnosed? Were you compliant with the medication? Did you feel that the medication improved your case? Any complications happened, etc. So we just analyzed what happened at the very beginning to know if make sure that the diagnosis was right at that time and she was just correctly diagnosed. Ever happened that she was admitted because of this or because of other symptoms, other problems? Yes or no? In case of yes, why? She was not taking the medicine, for instance, or she was taking the medicine but it was not effective. Okay, who followed her up during admission? Is it one physician or multidisciplinary team? Okay, then during admission, what happened? Now she's on a bed. They are giving her medication. What type of medications? Is it oral? Is it IV? What type of IV? IV fluid, IV chemotherapy, blood transfusion, okay? Any operations, any investigations done during admission? What was the result? Do you have a copy of those investigations? Okay, then any complications happened during admission? That's a very important question. How they manage it? Okay, during discharge, there was any discharge plan? Discharge medications? Was it effective? You were compliant with the medication, taking a medication on time? Okay, any follow-ups happened? They ask you to follow up or just take this medicine and go home? And if nothing happened, or if everything went smooth, did you travel? Did you suffer from any trauma? That's the past history, as simple as that. Don't complicate things. Things are very easy, but just think logic and stepwise, and you'll find things will move very smooth with you.
Okay, let's move to the next step, which is triple sword. You know what triple sword means? We want to take a history from 3 different age groups. If my patient is less than 2 years, I have to take prenatal, natal, and postnatal history. Again, I don't need to memorize anything. All I need to do to ask about prenatal. First, before delivery, what happened? Mom was smoker, alcoholic, she had fever, there was bleeding. Whatever happened, the mother need to tell you. Okay, when the baby they decided to deliver the baby. Was he term or preterm? And when preterm, what was the gestational age? Okay, well now we are about to deliver him. Is it an emergency or planned? If planned, preterm, why? If planned, normal, okay. What is the mode of delivery? Is it normal or is it cesarean? If cesarean, is it emergency? That means the baby, for instance, failure to progress, or the baby had deceleration, or what happened, made the obstetrician to decide to move to cesarean section. Okay, what was the outcome of the delivery? The baby delivered vigorous, pink, crying. That's fine. That we are okay. If the baby delivered blue and flat and breathe difficulty or not breathing, at this moment we need to ask about the cord blood as well, if the mother has any information about it. Okay, next, what was the where did they send the baby after that? In ICU, or the baby, for instance, everything was fine, were fine after the less than 5 minutes. So the patient went to a room. Maybe it was just he needed resuscitation for 1 or 2 minutes. Okay, and after that, the baby was sucking well. Everything was fine. Okay, did the baby have jaundice? This is the day-to-day scenario that we are all suffering and seeing every day. That's the common scenario. Jaundice. Okay. Next, before discharging, we are doing the hearing screening. How was the hearing screening for him? How was the metabolic screening? Okay. Then after that, the baby went home. Everything went fine, or you needed follow up with the neonatologist, etc. So we need to think stepwise, and everything should be fine. Now let's move to the next, from 10 to 14. The boy, did you see any whitish fluid in your underwear? Okay, when it happened, or if it happened, when did it happen? Okay, for the girl, when did you get the first menstruation? If she got it, was it at what age? We need to know, is it pre or on time? Early, I mean, menstruation, or on time? Was it regular? Do you feel pain with it? Okay, everything is fine with you, or do you feel like other symptoms like headache, abdominal pain, flushing, that stuff? Okay, then we'll move to 10 to 19. 10, 19, now we can summarize it in the word heads. Home, H for home, home life. What happened? Are you living alone, or are you living with others, with your family, with your friend? Second, education. Are you going to school, or the baby younger than 3 is going to nursery? And how is performing? How, in case of the boy, how are you performing in the school? How are your grades? Your relationship with your friends? Just think about it simply, logically. Don't memorize anything. Next, A for activity. Are you engaged in any sports in the school or outside the school? Maybe not sport, maybe music. Next, D, drugs. Are you taking any drugs, or are you smoking? Okay. Or in case of not smoking, are you passive or active smoking? Passive, that means somebody is smoking at home. Okay, and the S, usually it's not in our community here, and usually they don't ask, they don't really insist to ask about it, because we are a little bit different in our area here. But just to know that S for sex, suicide. Okay, so that's the end of the section of triple sword, and just remember it as less than 2, 8 to 14, and 10 to 19. Okay, now reaching the last section of history taking, which is Van Damme F. Start with V, vaccination, including the vaccination booklet if the mother has. A for allergy to drugs, food, or others, maybe contact. Okay. Nutrition, if the patient is neonate, ask about is mixed feeding, formula feeding, exclusive breastfeeding. The development, and that development we are going to make a separate detailed video in a couple of days. Attendance to school or nursery. in detail. M for money, who's financing the family. If the boy above 16, is he dependent or independent, is working or not working? Do you have any support from government, for instance? And etc. Now we're reaching to the last section or last part of the Van Damme F, which is family. And now again, please don't memorize anything. Look at the photo in front of you now. Okay, we have mother, father, kids, pets, furniture, curtain. That's it. Okay. How old is your father? What he's working? Is your mother working? Are they related to each other? How many brother and sister do you have? Do you have pets at home? Look at the bottom. You have a dog. What type of furniture do you have? Maybe they're allergic to some textile. Do you have curtains? Do you have carpets? Just describe and try to get all the questions from the photo in front of you, okay? And you're going to find that life is very, very easy. Don't memorize mnemonic for such thing. Just visual memory is much, much more important and more effective than mnemonic in such type of type of questioning patient just to memorize things. That's all. Okay, that's all what I have now. Now we're in the we have course on 21st of this month for 2 weeks, 6 days a week, 3 to 4 hours a day. We are going to implement everything I mentioned in this history, taking video over 2 days out of the 12 days, which is the course duration. And we are going to implement that on around 100 plus, more than 100 cases, okay? And how to present the case, and how to discuss with the examiner, and make sure I can guarantee that 100% of you were going to get 100% in this section.